For all the country's progress, barriers to social justice and economic equity exist in far too many corners of this society. Too many of our fellow brothers and sisters have died, sacrificed, and suffered at the illness that is racism. The 100 Black Men of Syracuse decided it's time for us to step out differently. How can we further the conversation to re-examine and create a more empathetic and inclusive society, one conversation at a time?
Yeah, so first of all, thank you so much for inviting me and for doing this. I think this kind of conversation is really important. A little bit about me. So I ran for office for the first time in 2018 and never thought I would be doing this, really. I was an educator all my life. I started teaching high school math, and then I got a PhD in Russian literature, and I taught Russian language and literature at the college level for a long time. And then I moved to Syracuse, and I got a credential in environmental science at SUNY ESF, and I went to work at SU in environmental sustainability, kind of teaching the faculty and the students about climate change and issues like that. So running for office was a whole new thing for me, but I've discovered that a lot of it is about education. It's about my learning about issues that are facing people all over this district and all over the state, but also then helping people understand how the political process works, how the government works, how you make change. And so it's kind of been an extension of my life as an educator in an interesting way. As a public servant, I feel like I can only do my job if I know and other people know that I'm accountable to them. And 50A was a clause in the public safety law that basically shielded police officers from that kind of accountability and said that we, the people who hire them and depend on them to do their jobs, couldn't really know if they were doing their jobs and if they were overstepping the line. And when we repealed 50A, we did a number of other things that I thought were really important. And one of them was called the STAT Act, which basically ensures that statistics will be kept about how the law is being enforced so that you can actually drill down and see, is there a police department or even a police officer who is disproportionately arresting, say, young men of color when there's no rationale for that? Is there a judge who is throwing the book at some particular group more than at others? I think until you have that information and you have the data, a lot of the time it's based on personal anecdotes and things like that, and even though they mount up to thousands and thousands of those anecdotes, it's still just anecdotes, and you want to have the data so that then you can say, okay, we need to change this, we need to replace this person, or we need to change the rules that are being followed here. I think we've seen this summer the police, we rely on the police really heavily, and when we've got the kind of gun violence, for example, that we have seen in the last 4 months, we want to know that the police will be there and will show up when they're called and will do their jobs. So that phrase, defunding the police, to the extent that people hear it as being that we're somehow getting rid of the police or replacing the police, I don't think that's what's meant by that phrase, but I think the phrase has been unhelpful because people have heard it that way. And I don't think very many people are arguing that we should get rid of the police. But I do think that, sort of like the military budgets at the federal level, that funding the police has been something that people in government have always said, oh yes, the more, whatever they want, we'll give it to them. And that hasn't served us very well, because it has meant diverting money away from things like mental health support or child services of various kinds, or just a number of other things. And the result has been so many resources have been piled into policing that we have come to then expect the police to take care of a lot of things that they're not trained to do. And so I think it makes really good sense to look holistically at how are we funding the police, what are we expecting them to do, and are they the right people to do that? And I think an honest appraisal of that will show the way to change the way that funding is allocated without getting rid of the police. The New York Health Act is essentially a single-payer healthcare system where it doesn't change who the doctors are who deliver the care or that kind of thing, but it changes how it gets paid for. And it gets the insurance companies out of the middle of things and has it be more of a transaction between the taxpayers and the government, essentially. And the result of it is that you don't depend on your job to get you health care, which is a big way that we do it here in America now. And you wouldn't have the kinds of surprises that people get, where you go to get the care that you need and suddenly you get a giant bill for it. Even I have great health insurance, supposedly. I'm covered by the state of New York as a state employee. But if you look at my monthly statement from them, my deductible for me and my husband and my daughter, the total's over $20,000 a year. So if we got really sick, we would be out a lot of money. And if you can get away from that kind of thing, I think our current system assumes that people have a lot of money socked away for an emergency. And I think one of the things that we're learning about the whole inequitable distribution of wealth in our society is that particularly people of color have been denied a lot of the resources and the sources of wealth building over their lifetimes that people who look like me have had more access to. And so I think at that level, just at that level, the extent to which our healthcare system depends on people, in a pinch, having to rely on a lot of family money, basically, to care for themselves. I think that would make a difference. I think more than that, we have a system, especially the employer-based healthcare system that we have now, doesn't apply to people who are doing gig work or part-time work or have jobs that don't offer health insurance. And I think, I don't know what the numbers are, but I would guess that a significant portion of of people of color in this country fall into those categories where they don't get employer-based health insurance. And then what that means is they're not going to go and seek the preventive care that they need, and they're going to wait until they have something, they're sick enough to go to the emergency room because an emergency room has to accept them. And that's too late. If you get to the emergency room, you have waited too long to deal with whatever the health problem is that you might have had. And so healthcare outcomes, we hear about maternal mortality and a lot of other disparate healthcare outcomes. In the COVID-19, the healthcare outcomes by race have been shockingly disparate. If a lot of that has to do with the either denial or lack of access to health insurance. So this system would make sure everybody was covered. And I think that could go a long way to addressing some of those disparities. So the decriminalization and expungement of records has been a very important piece, and we passed that. Like I said, I don't know if the governor signed it, but I think he did. I think we're past that. But actual legalization of marijuana has not happened yet. And one big reason why it hasn't happened in New York is because of a real debate about what that law should look like, and a desire on the part, certainly on the part of the Senate majority, the Democrats in the Senate, to make sure that the system that gets put into place is one that does address some of these historical inequities in how the drug laws have been enforced. We just saw a statistic that came out last month in Albany that 97% of arrests, marijuana possession arrests, were African American men, or maybe men of color. But in any case, it was an unbelievable statistic, honestly. I mean, you know that's not actually reflective of who's using marijuana, right? So it still is this is a law that's being used disproportionately and unfairly. And it has, the historical impact of it has been enormous. And so figuring out how to structure the new system so that those very communities that have been hurt so much are able to benefit from the rewards of decriminalization, of legalization, is it's really complicated, and it has to do with things like vertical integration, like not allowing the same company to do the growing and the packaging and the selling, all of the pieces of it, because if you allow all of that to be integrated, then that makes it much easier for big companies to come in and just take all the business. But if you compartmentalize it, then it's easier to have small businesses get power within the different segments of the enterprise. I have to confess that I haven't really followed the details of how people are trying to craft that law so that it really will be effective. But what they're doing is they're looking at Colorado, and they're looking at California, and they're looking at New Jersey and saying what worked, what didn't work, and how can we avoid the mistakes that were made in other places. And so that's one of the reasons why it's happening slowly. The problem with it happening slowly is that now that New Jersey and Vermont and Massachusetts have legalized marijuana, then this whole big market of New Yorkers wanting to buy marijuana, they're just going across the border, and the state is losing all the tax revenue and the jobs that could be created. And so, as you said, it's inevitable. It's also urgent that we legalize marijuana, because we can't afford, especially in this economic climate, to be losing that money, frankly. So it's got to happen soon. Well, it does take resources. It takes a lot of resources, and the Latin School got quite a lot of resources to make the transformation that needed. So you asked, is it the amount of money or the way the money's being used? To start with, it's the amount of money. That the city schools have much less per pupil than many of the suburban schools do. They get more dollars from the state because the state heavily invests in the big 5 school districts, the largest 5 cities. But the state does that because our dependence on property taxes to fund education means that a wealthy suburb where property is valuable is going to be able to raise a lot of revenue for their schools, and a city where property is less valuable, which is true in Syracuse, plus more than half of the property is not even taxable to begin with because it's government buildings and colleges and universities and hospitals. The city just cannot raise money to fund the schools with property taxes. It would be totally unaffordable to live in the city if we did. So the state steps in and makes up for it, but it doesn't come close to making up for the difference between, FM or JD school district and what they pay per student, what they spend per student, and what it's spent in Syracuse. So there is just a disparity in what is being invested in our schools. Then in terms of how it's being spent, I think, there are a lot of rules and there are a lot of expectations on the schools that are expensive. And in Syracuse, for example, we have a lot of new Americans who are learning English. We have a lot of kids with disabilities. We have kids who just need even larger investments than the average kid does. Kids living in poverty, kids living with a lot of trauma. And so the needs are greater, the outlays are less, and then there are some issues with the way it's being spent, but I think the biggest thing is that we need more money. The state created a formula 15 years ago for what should be, how the schools should be funded, and hasn't come close to fulfilling that formula. So we're something like $4 billion short in terms of what the state should be investing in education in schools like the Syracuse City Schools. So that's a big part of it, and I've been part of fighting for that money. It's getting harder to fight for that money as our state deficit gets larger, especially in the pandemic. So I don't know, what direction that's going to go in, but we're fighting that fight. So we are on the verge. I mean, literally in the next few weeks, we expect to get a budget adjustment from the governor that will basically say that there's going to be across the board cut of about 20%, and that will include school budgets at a time when their expenses are higher because they're trying to figure out how to open safely. So my colleagues and I in the legislature have committed to fighting those cuts, and partly fighting those cuts by proposing new ways of raising revenue, and legalizing marijuana is one of them. Taxing the very wealthy is another one. New York actually has a pretty low rate on the very wealthiest New Yorkers, and we have a lot of billionaires in this state who have gotten way richer in the course of the pandemic. And so we want to raise that marginal rate so that if you make $5 million a year, you pay a little bit more, a higher percent on that. Anything over $5 million or over 10 million or over $100 million have a little bit higher rate on that. If you go back to the 1950s, the rate was 90-something%, and it funded a great society, but right now that rate is extremely low and it does not fund what we need in our society. We're not saying bring it up to 90, we're just saying raise it from, 9.3% to 9.5%. It's basically, and I have that bill actually, and I have to say one of the things I'm really proud about is that I have co-sponsors who are Democrats and Republicans. So it's a bipartisan bill. It is, saying that the wealthy need to pay their fair share in this state. So that's, and education is one of the things where we want to plug the hole by raising revenue, not by making cuts.